Hello everyone, good afternoon everybody. I'm Priyanjali from Radiance with You YouTube channel. I'm sure all of you must be keeping good health. Today we are talking about something that affects everyone no matter where you live, fungal infections. We are going to have an important chat about them and how we can stop them from spreading by taking actions early. Fungal infections like athlete's foot or nail fungus might not be the first thing we think about when it comes to health, but they are important and can cause serious problem if we ignore them. They can make us really sick if we don't deal with them properly. But don't worry, we are not just here to talk about the problem. We are here to talk about what we can do about it. We'll look how to stop fungal infections from happening and talk about the latest treatments. This month is all about being aware of fungal infections and how to stay healthy. So let's connect today with our skin expert, Dr. Seema Jain, who is live from Ahmedabad, to provide us vital information on advocating for prevention methods to combat fungal infections. Dr. Seema Jain M.B.B.S. D.V.D. Skin is a consultant dermatologist, cosmetologist, and trichologist practicing in Ahmedabad since last 24 years. Visiting consultants to Rajasthan Hospital, Shahibaug and Sanjeevani Hospital, Vastrapur, Dr. Seema treated various complicated and dissatisfied patients to their utmost satisfaction from Gujarat, MP, and other states from India. Participated in various live telecasts in various public awareness program about dermatology and cosmetology. Dr. Seema Jain, with 24 years of experience, is offering world-class dermatological care to all her patients suffering from skin diseases. Dr. Seema is truly a patient and focused dermatologist. It is our pleasure to host you, Doctor, today. So, over to you. Let's start with the first question, Doctor. What is fungal infection?
Yeah, hi everyone, and actually, I'm so happy to be talking about this topic because fungal infections actually are very rampant in our country, very rampant. In fact, every alternate household you will have members affected with fungal infections, and because it is a contagious infection, so one person gets it in the family, and he eventually passes it on to all the family members. So that, and why this awareness? Because in our country we are staying in a tropical country, hot weather, and our hygiene practices may not be so good, and that's why so many people are affected with it, and so many mistreatments being done with some over the counter steroid preparations, unnecessary, irrelevant, illogical medicines which are actually causing contact allergy and a lot of other complications. So I'm so glad that you picked up this topic today because it needs so much of awareness. So why, what is fungal infection? Now fungus is an organism. Like in, we have bacteria, we have viral infections. Like we all know, we have had so many viral infections. So fungus is also an organism, and these are all microscopic organisms. We cannot see them, but they are actually causing so much of distress in patients. I mean, just unreasonable itching and so disturbing. And specifically, it occurs, in areas which are more in body folds, where there's a lot of sweating, a lot of humidity, and a lot of friction. So, like, not just in olden days, we used to just know about two things: athlete's foot and nail infections of fungal. But nowadays, they can spread all over the body. We see them in groins, buttocks, underarms, axillae, and they are so infectious. If you have scratched that area and then you touch your face with these fingers, infected fingers, you're going to cause it on your face also. It can just spread to any part of the body, including kids can also have it on their scalp, which is called tinea capitis. So now fungus, in other words, in simple layman language, we can also call this as yeast infections. Yeast is the fungus. So these are yeast infections. So there are a lot of other types, and sometimes, very rarely, we can also contract them from animals, our pets, like cats, dogs. Sometimes, if they are infected and we are holding them all the time, we can definitely get these infections. So hygiene is a must. Hygiene is of utmost importance, and we catch them basically from somewhere. So you have caught it from somewhere, and then you transmit it to others. Another major problem nowadays is because of the Western use of public toilets, which are all Western commodes, what we call.
Mm,
So in commodes, we are all coming into contact with the seed that is there. I always tell my patients that you should not touch the seat. Nowadays, we get very good disposable commode covers sheets, which can be taken when you are traveling along so that you can use them. You dispose them, you're not getting in touch with the commode seat. Then there are nowadays a lot of disinfectant sprays for commode seats. So you can use all these things also. So a lot of things, a lot of places from where we are contracting this infection. And it's an organism. So it can just multiply. Its food is sweat. It basically loves humid, hot, heat, and sweat. So moment it gets everything, it is good for its growth and it keeps multiplying very, very quickly and very, very fast.
Right, right. Well, now that we know what is fungal infection, doctor, how does it look like initially? Because most of us, we tend to confuse it with something other.
Yes. Yes.
Because skin being the largest organ, there are so
Correct.
many
Correct.
changes which we see in our skin on a daily basis. So, how does one know that he or she is having fungal infection?
Yeah, right. Very good question, actually. What happens is initially you will just feel like a small. Some people describe it as it's a छोटा सा फुंसी जैसा सा सिर्फ छोटा सा दाना था,
Right.
red था
Mm,
and खुजली आ रहा था, and we just neglected it. Gradually it grows in size. It grows in
mm,
size gradually, and then it takes the ring form, what we call in common terms a ringworm infection. So gradually it
right.
takes the ring form, and it has a character that it starts growing peripherally. Means it starts from the center, and then the lesion spreads peripherally. So you form those rings. And as you keep treating them, if you apply a wrong cream, the center heals, the ring goes on spreading further. So in some cases, you can actually see two or three rings. One ring, a second ring, a third ring. As if it's forming a circle. So it happens
Right.
mostly in groins. That groins is the first area where you catch, and
Mm,
underarms in females, under the breasts also. Buttocks are also
mm,
another area. So initially, it can look like a tiny red little thing, a
mm,
red boil, and then it is so
mm,
itchy, scratchy that it keeps spreading and it takes the form of a ringworm. So this is a tinea infection. There is
mm,
another infection, fungal infection, which is called a candida. This candidial infection, this is called yeast infection. This will not look like that red spot which has itching. What happens is it just becomes red. It is a very red flat lesion, but that area is very macerated. Macerated as if you have soaked your hands in water for 15-20
mm.
minutes. So how the washerwoman's hands are, macerated.
Right.
So the skin becomes red and macerated. So that is a
Mm,
candidial infection. And what I said was ringworm infection, that is tinea. So exactly how to differentiate, I think you should go to a doctor, consult a dermatologist. But
right.
yes, the moment you come to know that it's itching, you can just, for a trial purpose at home, you can just try a moisturizer, a max to max, an
Mm,
antibiotic cream like soframycin. If it is not
mm,
responding in 3 to 4 days, then
mm.
you have to get a perfect diagnosis done, because this is the only
Right.
thing which you should try at home first.
Right. So the lesion, doctor, it looks this
Yes,
like the both the patterns which you have mentioned just now. Is
yes,
it just
yes.
the two, or there are also some more patterns which we get to see in our body? Like we have
There
also
are,
seen,
hmm,
yes,
correct.
yes.
No, no, no. Yes,
So
you complete your question. I'm
we
sorry.
have also seen fungal infection affecting on the sides of the nails, maybe. So how does that look like? How does
What
fungal
happens is,
infection on our forehead look like? If you can please explain.
yeah. Actually, let's begin with the nails. Nail fungal
Right.
infections is very common in females because
Mm,
they are exposed to so much of water work all the times. The hand fingers remain wet. They are
right.
exposed to detergents, a lot of other chemicals also. So eventually, there is a nail fold. There's a space between the nail and the nail fold. So when the water, the sweat, the detergent, everything gets collected there, it gives you that, it gives the fungus the space to grow, because that stays moist. So it starts growing. Once it enters the nail bed is like a nail root. The way we have a root for our hair, we also have a nail root. So the moment it affects the nail bed and the nail root, then it starts eating upon your nail. So when it starts eating upon your nail, the nail which grows is discolored. It could be blackish, brownish, light, sometimes greenish, depending on the type of the fungus which has infected. And the nail may take a little dystrophic pattern. Like, it's not the smooth, flat nail what we have, but it can become ridged, or it may have some grooves and serrations. So you come to
Right.
know that your nail plate has been affected by the fungus. Second thing is,
Mm.
sometimes the nail fold is affected, right? So when the
Mm.
nail fold is affected, there will be a little swelling, it will be quite painful, and sometimes there may be pus oozing out of the nail. Only when the nail plate is affected, it is not painful and it has no symptoms. But this nail infection could eventually spread onto your skin, grow further onto your fingers or other parts of the body also when you touch. So sometimes it can become, and nail infections are very chronic, very, very chronic, more chronic
Mm.
than your skin infections, because the nail is an impenetrable protein where the medicines don't penetrate quickly. That is now nail
Right.
infection. So nail and nail fold. Now, like you mentioned, scalp. What
Right.
happens is, the mainly the scalp infections, fungal infections are common in kids, in children. So they get it from their schools, they get it from their friends when they're playing along. And again, the scalp infections are also of two, three types. Sometimes it's called a black dot fungal infection of the scalp. So what happens is, the hair from that area will go away, and you can just see fine black dots, and the child may have itching. So actually, most of the times the children will have itching, so you know that it's a black dot fungal infection. There is one fungal infection which is called a carrion. So it has a lot of swelling on the head, and there's a lot of pus formation and complete hair loss. You cannot even see those dots there. It's a huge boggy swelling, as if there is a big gumra you can see on the scalp. So that is actually an emergency, and it's better to consult a doctor immediately. So that's a carrion. Now, that is one in kids, what we see. There are nowadays in adults also these hair infections, because, for example, you had some men, they have fungal infection on their faces. Eventually, if the fungus is growing, it can grow onto your beard also. And once it penetrates the hair follicles, it becomes very, very stubborn to treat. The way I told you about the nails, it becomes very chronic.
Right.
Same thing happens with, when it goes into your skin, it is the epidermis. But when it's once it starts spreading onto your hair, it penetrates the hair follicles. The fungus penetrates the hair follicles. It starts affecting the hair follicles, and then it becomes very chronic, because our medicines, it's very difficult to reach the hair follicle and the nail plates. So it becomes very,
Right.
very difficult to treat, and they become very chronic.
Right, right. So, doctor, what about I have seen mostly old people. There
Yeah.
are the texture of the nail changes. Also, have seen some black lines, maybe discoloration of the nails. What is that?
Yeah, good, good, very good. This thing. In elderly people, yes, because those nail changes that are there, that is not fungal infection. It is because of their dystrophic changes over the period of years, some frictions, deficiencies, vitamin deficiencies, and if there are some surrounding skin itching, or some kind of eczema on the nail folds, then also the nails can become dystrophic. There are some skin disorders like psoriasis, where also the skin nails can have a dystrophic or a
Mm.
different look, not like your normal nails. They will look blackish in color or brownish in color with those ridges and grooves. So I think that to differentiate, it has to be a dermatologist, to exactly find out whether it's
Right,
a nail
right.
infection or it's a normal age related or friction related nail change.
Right, right. To all our viewers who are watching us, we are talking very basic today, and everybody who is watching us, you can relate to everything which we are talking. The next topic is also another relatable question which everyone can relate to, of course. Doctor, what is the difference between fungal infection and bacterial infection?
um, Basic scientific difference is that the organism is completely different. Fungus is a
Hmm.
different organism which grows, bacteria is a different organism which grows, and both of them are not visible to our naked eyes. Fungal
Hmm.
infections will basically cause itching. That's the main primary symptom of itching. Itching
Hmm.
is a primary symptom of a fungal infection. Bacterial infection cause those boils, pus-filled boils, and then they cause those abscesses, which can happen on your scalp, which can happen on your body. So, and they are more painful and tender, inflamed, red, painful. But normally, bacterial infections are never itchy. They will not complain of itching. The patient will say that I'm having pain over it, or it's tender on pressing, or if it has happened on buttocks, it's difficult to sit. Sometimes, because of these bacterial infections, there can be lymph nodes. For example, if it's on the scalp, they'll get some lymph nodes in the neck or in the groins. So basically, how you differentiate as a layman is itching will be the primary symptom of a fungal infection, and for bacterial infections, it's mainly pain and tenderness. It's never itching. So
So,
that way
so
you
what
can
can be
differentiate. Yeah.
right? So, what can be the causes behind both of them? We have already talked about fungal infection. What about bacterial infection? The cause behind it?
Bacterial infections on the skin. They can also occur because of the heat and the sweating sometimes. And what happens
Mm,
is majority of the times, if like the patient has scratched
mm,
for some other reason he has
mm,
scratched, general dry
mhm.
skin or a fungal infection also. So the hair root gets pulled out and the hair root gets infected with the bacteria. There are bacteria which are normal commensal bacteria on our skin surface also. Commensal means they are bacteria which are innocent. They don't affect anything in our on our
Right.
normal skin. But the moment you have scratched it, that means you have broken the barrier of the skin. These bacteria can penetrate in and then they can cause infections. So they can cause infections like not normal boils. They can cause there's one infection called cellulitis which can affect the entire subcutaneous plane. Subcutaneous means below the skin level, in the deeper in the skin and the fat layer. There the subcutaneous layer also these infections can spread and they can cause cellulitis, severe swelling, very painful. Bacterial infections can also go to your blood. Bacteria can enter your blood also. That is called a septicemic phase. So that can affect your entire body. And in that case, if the patient is a diabetic or something, then he can get multiple lesions all over the body and multiple infections anywhere in the body. And once it passes on to the blood, which is called septicemia, it could even affect other organs also. So
Well,
normally fungal infections are not invading your skin. That means what I mean
mm,
to say is they normally remain limited to your layers of your skin. That is your
mm,
epidermis and dermis, and max to max is our hair follicles. There are other fungal infections which are deeper fungal infections, but our routine, what we call nowadays, which is rampant, that is not deep, which does not penetrate the skin. There are fungal infections in the lungs and all, but that is a totally a different group of fungal infections, and that happens mainly in immunocompromised, means the patients who are
mm,
hospitalized, HIV or any other infections because of which they are immunocompromised. So those fungal
mm,
infections
mm.
are again different. That is a completely different type of a fungal infection, which are deeper in the sense they can affect your bones, they can affect your lungs also, but they don't
Right,
happen in normal individuals. Yes.
right. So, doctor, both the infections are contagious. We are saying that.
Bacterial and fungal.
Yes, yes,
Yes,
yes.
both of them are contagious. Both of them are contagious. Fungal infections are more contagious. Just with touch, also you can. There's a possibility you will get it. But bacterial
Mm,
infections, what happens is even if I have touched it, but if
mm,
my skin barrier is good, my skin barrier
mm,
is healthy, that bacteria may
mm.
not be able to penetrate my skin. So
Right,
less chances unless you have actually touched it and your skin was also abraded or broken, so the bacteria can penetrate.
right. Now,
So,
doctor, let's talk
hmm.
about the yes, yes, please, please,
So that's
please.
what I meant. That fungal are more infectious. Fungus is more infectious
Mm,
as compared to a bacterial infection.
right, right. So, doctor, let's talk about the preventive measures of fungal infection. Suppose someone in my family has fungal infection and I still have not gotten it. So,
Right.
what preventions can I take?
Yes. Now what happens is, so today we are mainly talking about the skin fungal infections, correct?
Mm,
These are
right.
called the superficial fungal infections, which I told you is like an epidemic going on in India and a lot of other countries also. And because of so much of extensive travel nowadays, it has spread all over the world. And like I was telling you, one member in the family gets it. It is better to segregate everyone else so that no one else
Mm,
gets it. Now, how do we prevent it? For example, someone in your family has had it. What happens is how this fungal infection is going to spread. When normally in any family, everyone nowadays, because of the good awareness and hygiene practices, everyone will have a separate towel. Normally, people even have started using their own soaps and own body washes. They don't want to share with anyone, so that's a very good practice, in fact. But what happens is, in whatever how much of a hygiene you are practicing, in every family, the clothes are washed in the same load in a washing machine. So what happens is, if one person has had it, his clothes are being washed in the same washing machine with everyone
Mm,
else's clothes. It is very easily transmittable. What happens is, normally it starts with, like I told you, groins are the first region, or sometimes under the breast, and axilla are the regions from where you start. So your undergarments should make it a point, even if someone has a fungal infection or not a fungal infection. Undergarments should always be washed separately. Each one has to have it separately. I mean, not to be washed in a common load. And if at all someone has had fungal infection, then better his clothes be segregated. They should not be used in the common washing machine. They should be soaked separately, washed separately, and dried nicely in the sunlight, because sun has UV rays which can kill the fungus. So that is one thing what you can do. And like I told you, soaps, towels, everything to be separated. See, it's not going to, if a person in a family has fungal infection in his groins, and if I'm
mm,
shaking hand with him, I'm not going to get
mm,
infection. But if
mm,
he is not practicing hygiene methods, for example, he's having it in his groin, and if he has scratched
mm,
it, he should make it a point to go and wash his hands, sanitize your hands properly. Do not touch it here and there. Not just touch his own body. Do not shake hands. So I'm sorry, so that you don't give the infection to someone else. So keep washing your hands, keep sanitizing your hands, and don't scratch it. That is the main thing. But once you start treatment, your scratching is going to stop. So we are not going to
mm.
transmit it to others. So one thing is clothes, your towels, your soaps should be separate.
Right.
But for a person having fungal infection in his groins, and if he's wearing clothes and he's lying on the bed, the bed sheet is
Mm,
not going to give you infection. So you don't have to worry about that.
right. Right. Uh, Doctor. Well, now that we have talked about one of the basic things, washing clothes altogether, we tend to forget such things normally. Uh, Also, you have mentioned sun drying the clothes. For people who are not able to sun dry their clothes, maybe for the lack of the space, or maybe they stay in a region which is wet,
It's
what
not.
alternatives can they apply?
Then you know what they can do is, first thing is, never, even if it's a little moist, never take it and wear it.
Mm,
Undergarments specifically, I you always,
mm,
you should always make it a point they should be completely dry. If it's not sun, then maybe under the fan or a dryer or whatever you have, but ensure that it's completely dry. You can have extra pairs till you don't dry your garments completely. That's one thing. And second thing is, if someone in that case could just use an iron. For example, there
right.
are people like in Bombay, or which are, when during the monsoon season, it's humid and shady and raining all the time. So the clothes don't
Mm,
get dried. So that in those cases, we tell them to iron their clothes and wear it, so that the fungus is heat sensitive also. The organism heat sensitive, not like our normal temperatures, but a high iron heat. So when the ironing is done on the clothes, it will get killed.
right.
I mean, we
Well,
can destroy the fungus. Yes.
right, right. So now we have got the solution already. Let's dive into the next question, Doctor. Are there specific populations that are more susceptible to fungal infections? And if so, what preventive measures should they take?
What happens is, population wise, if we go, children are less affected with fungal infections. Children
Hmm,
only, normally it's only the scalp, body fungal infections. The skin fungal infections have less tendency for kids, so that's a very good thing. But yes, from they can catch it from adults. But the main population which is being affected is the working population, the youth. Why? Because they are physically active, they are more active outdoors, and they sweat a lot when they are working out. Then some people have a sedentary jobs, like sitting in the offices on chairs constantly. So these areas tend to remain humid and moist, basically, specifically who are all the time sitting in the chairs. Then there are college youngsters, because they tend to wear a lot of jeans and all, and jeans, the fabric is so thick, which is not actually meant for our weather, which actually gives them a lot of sweating. Girls wearing a lot of leggings. Leggings are tight fitting, snug, and you tend to sweat more in those leggings. Then there are elderly people. Again, chances of catching fungal infections are less, because they sweat a little lesser than others, because their metabolism is slow. They tend to stay indoors. They are not active, physically active like youth. So that is also a reason where elderly population and kids have less chances. But youth, young and middle aged people, these have, and specifically who are going more outside, marketing jobs, sitting office jobs where you're sitting constantly on a chair, even if your room may be chilled with the AC, but there are areas like groins and all which tend to remain a little wet and moist. So there are going to be solutions for it, which we can come later when we are discussing again how to manage these.
Hmm.
So this is the population, which is more going to be affected because of the fungal
Right,
infections.
right,
And
right.
yes, one more
Doctor,
thing. Just one mention. Girls,
yes,
young girls, because of their menstruation, they are using those sanitary napkins. Of course, they have to. So it remains very moist and humid. That area remains very moist. That can also cause a flare up of fungal infections.
right, right. Doctor, what role does physical exercise play in fungal infection?
Physical
Also, what about
exercise.
obese patients? We have heard that they have a tendency of having fungal infection very easily.
Right. So first thing is physically active. What happens is it's so I don't tell my patient that you have to stop working out or you stop your physical walk activity like a walking or a jogging. You don't have to stop that. But I tell
Hmm.
them ensure that after you have come back from your gym workout, walking, jogging, swimming, come back and take a bath immediately. Don't stay in those clothes, sweaty, humid clothes for a longer period of time, because
Hmm.
when the areas are humid and sweaty, you are giving the fungus actually an opportunity to grow. It needs that kind of an atmosphere. The fungus wants an atmosphere which is humid and moist, so it starts growing. So we tell them that don't stay in those humid wet clothes, sweaty clothes. Take a bath immediately, and every time you wear a cloth, do I mean anything, your undergarments or your shorts, do not repeat them, put them into washing, because sweat is the main factor. Sweat is like it's food. So that is what the fungal infection fungus needs, the sweat. So that is one for physical activity, because you are going to increase your sweating increases. So just make it a point. Your sweating is going to increase, but then make it a point to take a bath. Stay dry, stay hygiene, take care of your hygiene. So then you won't get these fungal infections. Second thing is another problem with the gyms and all is again the same common washrooms, common toilets. You're sharing something, so just
Hmm.
see to it that everything is hygienic. When you're going to these washrooms there, see to it that you don't touch upon those commode seats. Try to use those disposable commode seat covers if at all you have to use. And but anyways, you don't have to stop your physical activity for that. You can continue, but take care of your hygiene. That is the most things. Just take care of these small things, and we need not stop our routine lives. Second thing, what you said was obesity. Again, obesity
Hmm.
means more sweating, more body folds, because the abdominal fat would come onto your groins, everything. Body folds are more on the lower abdomen. So wherever there are body folds, the sweat is going to collect and stay for a longer period of time in contact with the skin. So it provides a perfect atmosphere for the fungus to grow. It keeps growing and multiplying again. So that is where obese individuals. And third thing I like to mention is again diabetics are more prone to these fungal infections, because their
Right.
skin is already also having a lot of sugar content. Like when you
Hmm.
have a high blood sugar, your skin also has some levels of sugar. So and fungus likes that, it likes to eat sugar also. So diabetics are more prone to fungal infections.
Hmm. Hmm. Hmm.
So
Right,
these
right.
yeah.
Doctor, you mentioned gyms, and just after you mentioned, I recall last month I have met a person who got a fungal infection on his thumb. So
Okay.
the doctor has told him it was probably because of the sweat of somebody else's in the gym, which where he goes.
Yes,
So,
yes, yes.
what
Perfect.
preventions can the gym goers take for if the
Yeah.
case is such, because you never
Yeah,
know
yeah.
who is having fungal
Yes,
infection.
yes, it happens. What happens is, I have had patients nowhere on the body they are having fungal infection, but for example,
Mm,
like a face or a hand, like oh you mentioned the thumb, and this they could have gotten from all those machines being shared. So
right.
good gyms always use, they keep sanitizing their
Mm,
machines
mm,
and the
mm,
seats, gym seats and all. But yes, we should also take care that once you have used the machines and all, after you have finished your workout, nicely sanitize your hands, wash your hands, and wear gloves when you're working out. Mainly gloves are actually to for workout is to prevent those callosities and all and the friction on your hands. But when you cover your hands with gloves, what happens is you're not going to contract those infections directly. Even then your fingers may be exposed, but then the area is less. But keep sanitizing, that is the rule. Keep sanitizing not during the workout. After you have finished workout, maybe you could nicely sanitize your hands, wash your hands, and during your workout don't touch anywhere.
right. Right.
But
Doctor,
some gyms do
well,
follow, sanitary, yeah.
yes, yes, right. Well, initially in the session, you have already mentioned that immunity has got to do a lot of fungal infection. So, are there any dietary or lifestyle habits that can help boost the immunity system and reduce the likelihood of fungal infections?
Uh, Immunity is like the basic immunity what we have is also good because that also helps in our immunity towards fungal infections. So the rule goes that
Mm,
eat well, eat healthy. Obviously, junk foods and all, excessively spicy foods, excessively masala foods, they're definitely going to cause more sweating. So again, more yeah. So food habits are better to avoid, junk foods and heavy, oily, spicy foods. Basically, vegetables, fruits are definitely going to give you more immunity. So we have to make it a point to eat a lot of veggies and lots of fruits. These are going to help you. Lifestyle. I tell my patients we are staying in a hot, humid, and a tropical country. Not everyone can afford an AC all the time. There are people who are into marketing and sales. They are moving outdoors all the time. So for them, I tell them you should make it a point after you go back, whatever the season, take a bath in the evening. After
mm,
morning bath, evening bath is essential. Once you have worn a dress or your trousers or your dress, do not repeat it again. Put it into washing. Although you have not sweated well, sweated too much, it's been winter season. But these areas like your groins, like your axilla, a little sweating is also always going to be there throughout the year. So always put it for washing. Never make it. Never repeat your clothes. Because why I'm mentioning this? Because youngsters have a habit of wearing jeans to colleges, and they repeat those jeans. They keep repeating it because jeans is something which is
right,
not to be washed. No, I
right.
tell them no, no,
Agree.
no. We are not staying in a cold country where you need not wash your clothes very regularly. We are staying in tropical hot country. So we have to, I
Mm,
tell them, even if you're wearing a jeans, put it for washing. Once you have worn it, do not repeat it. That is one lifestyle habit. And second thing is, specifically in our summer months and our monsoon months, avoid wearing jeans because jeans are tight fitting. I understand fashion is the reason, but they're too tight fitting, snugly fitting. The fabric is thick, which is going to give you more sweat. More sweat. The more you sweat, the more the fungus is going to grow.
right.
And yes, weight gain. I mean, weight gain is again like what I told you, obesity, more folds, metabolism is high, sweating is more. So you should definitely cut down on everything.
Right, right. Doctor, what preventive measures can healthcare professionals take to minimize the risk of nosocomial fungal infections and in healthcare settings?
See, nosocomial fungal infections actually, nosocomial means that you catch an infection from a patient who is already in your hospital. Now, nosocomial infections are more common in ICU setups where a person who's having a lung infection could transmit it to someone else through the ventilators or the shared tubes or whatever. But of course, nowadays everything in hospitals they do take care. But for the superficial fungal infections, for healthcare professionals like nurses, sisters, paramedics, they for them one rule is sanitizer and gloves. So keep sanitizing your hands if at all you have touched someone, and if at all you know that you're going to be handling the patient, then it's good to wear gloves. So nurses, paramedic staffs, I always tell them don't touch the patients because the hospitalized patients they have to they have to move the patient to the side, they have to turn them, everything they are handling. So it's good to
Mm-hmm.
wear gloves all the time and sanitizer. These two things will help them from catching fungal infections from the patients.
Right. Doctor, are there any advancements in preventive therapies or vaccines for common fungal infections that individuals should be aware of?
Actually, there are no preventive vaccines for superficial fungal infections, but preventively, what we can do is there are antifungal powders available. So what we can do is make it a point that after you take a bath, you can use those antifungal powder dusting in your underarms, in your groins. This could work as a little preventive factor, but as such, still no vaccine is available. But
So,
of
what are
course, the
the
medicine will help.
treatments? Right. Uh,
Yeah,
so, doctor,
treatments
what are
is yes, yes,
yes,
mention.
yes,
Tell me.
the treatments which are currently available or which are currently taken for
Currently, a lot of antifungals are available, and actually, just the topical creams and all don't help. We need an oral antifungal also. We need a good topical antifungal also. Topical antifungal creams and topical and oral antifungal medicines. But of course, they have to be taken. They have to be taken only with prescription from a qualified dermatologist. Never try to buy them over the counter from your the chemist giving you knowledge from the chemist knowledge his own experience. No, you cannot rely on them. That is first thing. Now second thing, very important, and which is very bad going on in India. In India there are no rules, there are no laws. Anything is available over the counter. When you go to a chemist and you just tell him in simple Hindi language, मुझे धाद हुआ है भैया, कुछ दे दो. This is
mm,
the normal thing,
mm,
what trend, what goes on in India. And what will he give you?
mhm,
He will give you a triple combination cream which has a steroid, which has an antibiotic, and which has an antifungal. The steroid is very, very potent. The antifungal and the antibiotic may not actually damage your skin, but the steroid
mm,
part is the reason why the infections from in India it's now not getting cured. The
mm,
steroid is actually the making the fungus more and more resistant to antifungals. So because of that, when we give a routine therapy of 6 to 8 weeks, the patients don't get cured. They are fine. Again, they come back with recurrence of fungal infection. Because what the steroid does is the steroid temporarily will relieve you of your symptoms. So the patient feels, oh, I'm relieved of my symptoms and I'm good and I can just use this cream. And normally these steroid creams are cheap, 20 to 25 rupees, which is nothing in India. And they keep buying it, using it over the period of years. So because of the steroid constant chronic use of steroids, the fungus becomes so damn resistant. Plus, the steroid causes atrophy of your skin, atrophy meaning thinning of your skin. So there is no skin barrier complete left. The skin barrier becomes penetrable. The fungus starts penetrating in. It goes deeper into your layers of your skin. So it becomes more resistant to medications. The skin becomes atrophied. If you have, if someone has ever had it, you would know the stretch marks, not the normal stretch marks what females get in pregnancy, but patients develop such huge, wide stretch marks along their groins, which can extend sometimes up to their knees. So that kind of a havoc a steroid can cause. Steroid is like temporary relief, but actually it works like acid. I tell my patient it is worked like acid on your body. So when you drop acid on the floor, you feel the floor is completely bright, but no, it has damaged your floor. So it's actually damaging your skin. And because of the resistance, the medicines do not work well. What happens is routinely fungal infection therapy used to be 4 to 6 weeks, 8 weeks maximum. Nowadays, sometimes the patient have to take it for 4 months, 5 months at at a complete length, of so much of medicines because of this havoc caused by steroids. So these triple combination creams. So that's why I tell my patients never, never, never go and ask your chemist to treat you. He's only a chemist.
mhm.
He can only sell medicines. His experience, his knowledge is zero in diagnosing and treating. So don't follow them and do not buy over the counter medicines. It's always good. You need to pay the fees, but you don't hesitate in that. But get yourself treated correctly with a correct qualified dermatologist with correct medicines, and you'll never develop a side effect and you'll get a perfect cure for your infections.
Right, right. The entire scenario sounds very scary, doctor. But if you could please bring a sign of relief for all the people who are watching us right now and who are probably very much scared. Is fungal infection completely
Yeah.
curable?
Yes, yes, it is. See, why I'm trying? I'm not trying to scare anyone. The
Mm-hmm.
best part is this superficial skin infections, superficial fungal infections are never going to penetrate your skin, so they are never going to enter deep down into your body and affect any other organs or your blood. So the main thing is it is not life threatening. That's a very good, I think that's a very, it's a sign of good relief that it's not life threatening. It's only sting. But that is the problem, because it is not life threatening. Patients don't consult soon. They go to their chemist, they will go to a family doctor. Sometimes even family physicians give them steroid combination creams, or even the chemist always gives them a steroid combination cream. So actually what happens is, why the scene has become so bad. Fungal infections are completely curable, but the why the scene is so bad, because of these steroid creams, because of these over the counter products. You won't believe, there are some villages in some these things, the patient is given injectable steroid for months together, and the patient has developed a lot of other side effects to steroid. So the scary part is not being treated by a correct person. So see, nowadays we are all so aware, we are all well read, we have an internet with us. Let us be aware, let us check the degree of a doctor, let us see if he's
Right.
he's qualified dermatologist or not, then consult,
Mm-hmm.
rather than going to any quack, or forget the quack, going to a chemist and asking him for that cheap tube, and he keeps giving them that tube. And the funniest part is, in India, these creams are so cheap, 30 35 rupees, and patients buy for years together. And I tell them, you put thousands of rupees into that, but you never bothered to see a dermatologist. Are we so
Mm,
expensive? So that is the scary part. The scary scene is this,
right.
which has
Right.
been created. And because we don't have laws in India, anything is available over the counter, we don't need prescriptions. So what happens is, over the counter, you don't know what you're using, you just bought it and use it. So that is the
Mm,
wrong part, no? So scary part is that. The relief part is that it is a completely curable infection. Visit a qualified dermatologist, get a correct diagnosis done, follow your instructions what your dermatologist gives you. See, again what happens? People consult a dermatologist. After 2 weeks of therapy, they feel, oh, I'm completely all right. Why has the doctor asked me
right.
to come for a follow up? And
Right.
why I'll go again? Why I'll give him the fees again? Why I'll spend so much money? I'm all good. I'm perfect. Family member ko ho gaya, I'll give him that cream. I'll give him my medicine. My wife is also fine. My kids are also fine. But like I told you, fungal infections recurrence is very common. Why? Because we are staying in a
Mm,
hot and humid country. So if the fungus has penetrated a little deeper into your hair follicles, it needs more weeks of therapy, sometimes 6 to 8 weeks of therapy. And if the dermatologist has asked you to visit him and asked you to take a follow up, go and visit him. Follow his instructions, her instructions very clearly and to the point, and you will see there's a cure. It is completely curable. The only thing is, you follow the instructions and completely follow your dermatologist. Don't self treat.
right. Right. That's what we always suggest our viewers that please do not go for self medication. You are just making your condition worse. Do not do that. You are trying to save your money, but if you see, you are spending more. You are also
Yes,
hurting
yes, you are
yourself.
perfectly wrong. Perfectly.
Yes, you are putting your health at risk and you are also somehow spending a lot of money into that. So do not do that. And the
Right.
reason why we have experts to help you out, guys, please don't do that. They are always there to help you out. Reach out to a nearest expert and try to get yourself tested in the initial stage. Don't make it worse. That's what we always suggest our viewers. Well, that was Dr. Seema Jain for us. Doctor, we still had a lot of questions, but I think we have so much to talk and so much to know from you today that we have fallen a short of time. We believe that we are going to see you very soon once again. Thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers, and it was great to hear from you. We'll definitely look forward to many more such sessions. And for all our
Thank you.
viewers, thank you so much for your active participation. And We know that you are going to stay connected to us, to our channel. And please do not forget to subscribe to our channel, Radiance with You. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you so much. Thanks.